So just wrapping up osteoporosis, I truly think the treatment is individualized and up to the treating physician. I would not make any recommendations on any particular drug without being someone who treats osteoporosis on a regular basis, and also the formulary, the patient's insurance may actually dictate which drug they get. Now we're going to look at some x-rays of arthritis. I'm going to give you a little tutorial here. This is a good looking knee, and you see the joint space that's running between the two bones here. That's indicative of where the cartilage is. As long as there's good joint space between the two bones, you know there's cartilage there as well. Compare that to this knee, and you see we still have joint space on the lateral side, which is the outer side of the knee, although these are little bone spurs that are developing. But on the medial side, the cartilage is all gone. It's pretty much bone on bone. And so this is an arthritic knee. The medial side here, the inner side, most of us are a bit bow-legged, so we tend to wear out the inner side first. That's most common. Another example of now you see this medial side's even getting irregular. It almost looks like a Ruffles potato chip. And again, those bone spurs. And then I think this is a really awful looking knee. This knee needs replaced badly. So now we're going to go look at some hip pictures. And I think this hip, to give you a sense, this is kind of a round hip. You can see the ball. There's a little bit of space left there. I think this hip is getting some arthritis, but it looks pretty good otherwise. Compare that to their other hip where the ball is not really round anymore. The cup is hard to see. The space is minimal. This is getting to be a pretty arthritic hip. In fact, this hip's even starting to protrude into the pelvis. It needs to get replaced sooner rather than later. Another picture of a bone-on-bone hip, kind of even scooting out of the hip joint. That's a very arthritic hip. You see that the space is gone, and these are very large bone spurs that have developed in response to the arthritis. Compare that to their normal-looking hip on the other side, where it's a nice round ball, round cup, and there's joint space left. This hip needs to be replaced. This person is probably not walking very well at all. Now we're going to look at some shoulders. And this is what a normal shoulder x-ray looks like. You got the nice ball sitting on the glenoid, the golf tee, and there's space between the two, and things are looking pretty good. Now we're going to flip back and look at some more arthritic shoulders. This is a very arthritic shoulder, and this is due to chronic rotator cuff tear, actually. That the rotator cuff is gone, so the shoulder, the humeral head has actually moved superiorly and is now bone on bone, not only just on the glenoid, but also superiorly on the acromion. And so this shoulder, actually, the treatment would be a reverse total shoulder replacement. This is a more typical shoulder arthritis where the ball is no longer ball-shaped, it's getting more elongated and egg-shaped. The space between the ball and the cup is just incredibly narrowed, and this is a large bone spur on the bottom. And now we're going to see if we can find some pictures of ankle arthritis. This one's really bad. You see that all the space is just pretty much obliterated. There's not much left to see. And ankles, unfortunately, there's not great answers for ankle arthritis. So this is a bad look at ankle, and probably would just be fused. Ankle replacements are out there, but not super happy with them yet. Give you a sense, this is a little bit more normal looking ankle. You see all that joint space that's still present around the talus. That's called the mortise, this box in here, and compare that nice amount of joint space back to the one we had before. So I hope this has helped. I'm more than happy to answer any questions y'all might have. Good luck with your coursework, and send me a shout if you have any questions. Thanks.